I was born in Vietnam, and at the age of 12, I immigrated with my large family of 9. I have 7 sisters and brothers and my 2 parents to the United States. We settled in San Antonio, and we pursued a new life from that point on. My parents are education evangelists. My father always said knowledge is power, and that's the only way you get out of poverty and progress and build a life. So they always encourage us to pursue all of our academic studies, and at the same time we became musicians. My whole family are classical musician trained and had performed in various classical music festivals. We had put together recitals here as a family in San Antonio, Texas. We take some of that experiences within the family into our profession, and for me it's the practice of medicine. So I treat my patients like family members, as if I would treat them like family members. And I enjoy that aspect of medicine very much. Plus I feel like I make a difference, and that's why I look forward to coming to work every day. It's just fun. So I decided medicine would be a good fit. So I went to med school, and I went to med school here at the University of Texas Health Science Center in San Antonio. I did my residency in Virginia and returned in 1994 to start my practice, and that was 19 years ago. And really enjoying the practice. I enjoy seeing my patients every day. I have great passion for my job because it's never boring. You never know what's going to walk through those doors. And the patients are human, and we relate to each other on a human level. I treat the patients as human beings first, and their medical issues somewhat in concordance with that, but secondary. And so I think the patients enjoy that, they appreciate that. Here I am 19 years later, still going strong and enjoying it. You know, medicine is just a complicated field. There's a lot of information out there that we have to stay on top of and keep up with. So the way I do my best to stay on top of the latest development in medical issues are to attend meetings on a national level, also at a local level. I'm always reading medical journals whenever I can get a chance. I do a lot of online continuing medical education courses in order to make sure that I'm gaining the freshest information out there coming down the pipeline regarding our fields. Because I think it's important that if I'm educating myself, I can pass that education on to my patients. And hopefully that will really help to enhance their health and the disease management down the line. I see a variety of patients. Our practice primarily composed of anybody from 2 years on up to 90+ years old. So I see a variety of patients, variety of medical issues. It's never boring. That's why I like family medicine, because we treat the family. I've had family members that are with me for the last 19 years since I started my practice, and they become family. So the title of family medicine truly is what it is. It's treating the family and being part of a family. And that aspect of my practice I thoroughly enjoy, is the relationship that you make through the years with people. You know, I had a case of an elderly Vietnamese female. She's in her 70s. She came in to me complaining of fatigue and not eating well for about a week. She's coughing. Her chest x-ray shows pneumonia in the right upper lobe. Her pulse oximeter, which shows her the oxygenation in her bloodstream, it was extremely low. A case like that required immediate hospitalization and admission for intensive treatment of this particular infection. Being Vietnamese, however, she was not comfortable with that idea. She wants to be around her family. The Asian culture is an extremely family-oriented culture. So we worked around that. We prescribed her with some antibiotics that are just as potent orally as it is IV antibiotics. The medicine's called Levaquin. We arranged for home health to check on her every day at home, to give her family the support that they need and the education they need to keep her well. We arranged for oxygen to be delivered to her home. We arranged for a nebulizer machine to give her nebulizer treatment as if she was in the hospital. And I saw her 3 days later in the office. She was 50% better. A week later, she was 75% better. And 2 weeks later, she was ready to go back to full-time work at the age of 75. So in that instant, I learned that not every cases of pneumonia needs to be hospitalized. Sometimes you have to listen to your patient and do the best you can to work with their needs and their wants, and at the same time accomplish your goal to treat the disease process. So in this particular case, we find a balance to do both, and I'm really happy to share that. Over the course of the few years I've been in practice, I've recognized that medicine is becoming more and more costly for the patient. So when I treat a patient, I keep in mind that the tests I'm running needs to be pertinent tests that's going to help and aid me in the treatment and the diagnosis of their disease process. Secondarily, the prescriptions and the medicine I give for the disease management needs to also be in line with their cost and cost scale. And a lot of it is what their insurance is willing to pay for at the lowest level possible. We call it the formulary level, which means that it's relatively reasonable in cost and it's not outrageous. And patient most likely could afford to buy it because at the end of the day, it's about the compliance of the patient taking the medication in order for us to treat the disease process and see some sort of success in managing the disease and the medical problems. So those are the issues I keep in mind when I treat a patient and their disease. I can handle most medical issues. However, there are certain cases and situations where assistance is required, and that's when I need my specialists here in Stone Oak. And I've been with this practice for 10 years, and the Stone Oak specialists here, we have a very good relationship with our specialists. I can easily pick up the phone, and they would, answer the call immediately. We discuss the case, and in most cases, if not all cases, the patient will be seen as soon as possible, depending on the severity of their problem. So I feel really comfortable, very comfortable calling up my specialists, the people I use, because we've known each other for so long. And together we take care of the patients, because at the end of the day, it gives me peace of mind that my patients are taken care of, and they're happy that we are so, we respond so promptly to address their issues. And so it's a win-win situation in this case. I view my duty to my patient as one of dedication. When I see a patient, I find most of the time that if I allow them to speak, and I usually sit back and just listen, then I can kind of find out what it is that they are coming in to see me for. So my duty at that point is to give total attention of my time. We focus on them. It's not about me. We focus on their concerns, their issues. I honor them by giving them my listening ears, the validation needed for their concerns. Because I find that if you listen and you validate their concerns, they are then they're more cooperative with the treatment plan that we discussed, and more likely to be compliant down the line, because they walk away feeling like, gosh, this doctor really cares about my needs and my issues, and they don't feel rushed. That is how I view my dedication and my relationship with my patients. It's the fact that I need them to walk away feeling like somebody cared, somebody paid attention.